We are now recording this session on the role of faculty in student mental health. I would like to turn things over to Marjorie Malpede, Executive Director of the Mary Christie Foundation.
Hi, everyone, and thank you for attending today's webinar on our new survey report, Faculty's Response to Student Mental Health. Dr. Sarah Lipson will bring us through the findings, and a panel of experts will then discuss the implications, after which there will be a Q&A session, as Ken suggested. So before we get started, I'd like to thank our sponsor, the Hazelden and Betty Ford Foundation, for their generous support. And I'd like to ask Nick Motu, the Vice President of External Affairs, to say a few words. Nick?
Thank you, Marjorie, and thanks all for being here today. The Hazelden and Betty Ford Foundation is very proud to have funded this very important study. When young adults leave the protective cocoon of family and enter the collegiate environment, faculty can serve as critical touch points to both recognize when a student may need help with a mental health or substance use disorder issue and when and how to refer those students to the help they need. We hope this study opens those doors of opportunities. As the nation's largest nonprofit provider of treatment services, prevention, recovery support, and SUD training and education, we believe that the insights collected by Boston University, Healthy Minds, and the Mary Christie Foundation will provide a rich platform from which colleges and universities can support and expand faculty's role in the healthy development of students. I'd like to particularly thank Fred Chicos and the entire staff at the Mary Christie Foundation for their support of a number of research and education initiatives that were made possible at Hazelden Betty Ford Foundation over the last 5 years. Now it's my pleasure to turn it over to Sarah Lipson from Boston University School of Public Health, the principal investigator of the study. Sarah?
Hi, everyone. Welcome. I am so thrilled to be here today and to be able to share some top line findings, which are hot off the press from our new study. As Nick mentioned, my name is Sarah Lipson. I use she, her pronouns. I'm an assistant professor at the Boston University School of Public Health. And I had the great privilege of working with a team on this new study. So I'm going to take about 20 minutes to do this top line kind of overview of findings. And I'm going to begin with a brief kind of context for why this is so important, why this topic really matters, especially right now. So for adolescents and young adults, mental health problems are the largest burden of disease of any class of health conditions. And student mental health is one of the most significant challenges facing higher education today. The traditional college years of about 18 to the mid-20s directly coincides with the age of onset for lifetime mental health problems. So 75% of lifetime mental health problems will onset by age 25. Meaning that many college students will experience their first signs and symptoms of a mental health problem while in college or university. As you can see here in this graph, which is showing some data from our National Healthy Minds study, our survey of college students, we've seen a rising prevalence of mental health problems in college student populations over the last 10 years, and in particular over the last 5 years. Peaking in fall of 2020, when 39% of all students surveyed nationwide screened positive for clinically significant symptoms of major depression based on the Patient Health Questionnaire 9. Also in fall of 2020, 83% of students indicated that their mental health had negatively impacted their academic performance in the last month. Research led by my colleague Daniel Eisenberg at UCLA has shown that depression is associated with a twofold increase in the likelihood of stopping out or dropping out of college. And that's even when controlling for prior academic performance, test scores, and high school grades. So the topics of college student mental health and persistence and retention in higher education have largely been really two separate dialogues. And I think that faculty kind of exist at the intersection of both of those dialogues. And I really feel that there's a need to bring these two dialogues together, particularly from an equity perspective, when we think about the students who are the least likely to receive services for their mental health. Those are also some of the same students who have the lowest rates of persistence and retention in higher education. So low income, first gen students of color. So for many reasons, including the connection between mental health and academic performance, faculty are really uniquely positioned to play a role in campus mental health. There are over 22 million young people enrolled in U.S. post-secondary education. And as I said, these problems are not unique to college settings. It's really that there are opportunities for early intervention and prevention through the college environment because of the rich network of human resources on college campuses. So this, of course, includes peers, student affairs professionals and campus staff, residential life, athletics, and also faculty. However, what we've seen in the pandemic is really an increasing role for faculty in supporting student mental health. I know for myself as a faculty member, it was really the second Zoom class in March of 2020 when I realized that in the week in between our first Zoom class and our second Zoom class, that I may have been the only person at Boston University to have spoken or directly interacted with my students in that time. So faculty have always been really important stakeholders when we think about campus mental health, and that has really been underscored by the pandemic. There's a lack of research on faculty's perceptions of and experiences with student mental health, and those data are needed now more than ever to inform programs and resources. So this was a survey that we actually began before the pandemic, and then the urgency and the need for this became even more important. And I think that's reflected in the hundreds of folks who have been able to join us today. So this study, the role of faculty in student mental health, we did this as a pilot study in spring of 2021. It was an online survey conducted through Qualtrics, and we collected data from January through March of 2021. And the study had 4 survey sections. So the first was a basic kind of participant characteristic section where faculty indicated their gender identity, their academic discipline, their number of years of experience working as a faculty member. And the second section was about faculty members' knowledge and attitudes related to student mental health. The third was about faculty's experiences actually talking with students and making referrals. And the fourth and final section of the survey was about faculty members' own well-being. We conducted the survey at 12 colleges and universities across the United States. The survey was open to all types of institutions, community colleges, 4-year institutions, and the 12 institutions in the pilot study are located in 10 states. They have varied student body sizes ranging from 2,000 to over 20,000 students. And so we're really excited that we were able to have a relatively diverse sample of institutions, given that this was a pilot study. I want to say a huge thank you again to the Hazelton Betty Ford Foundation for funding this research. It's always a risk to do research in a really new area, and we're just so thrilled that we were able to get their support. And to my colleagues at the Mary Christie Foundation, who are just such fun and wonderful supportive collaborators throughout all of this. My colleague Amber Talaski from the Healthy Minds Network, who led all of our institutional recruitment and enrollment and interfacing with all of the institutions. And my colleague Nina Caesar from Boston University, who led all of the data reporting and data analysis and has also just been such an incredible collaborator in this. So I'm going to dive into some of the sample characteristics from the study. So we had 1,685 faculty members participate from the 12 schools. We had a response rate of 27%. Though this was a pilot study and, we're not trying to make any claims of national representativeness, we were able to compare the characteristics of our sample of respondents to the national characteristics of all faculty in U.S. post-secondary education. And we were pleased to see that our sample is actually relatively representative. You can see that it does skew a bit towards female participation. So 58% of our sample identified as female, relative to about 46% of faculty nationwide. So without further ado, I'm going to jump into the findings. All of these findings presented here are also in a data report that will be circulated after today, along with the slides and the recording as well. So I also want everyone to sort of put on their hats of getting ready to hear a lot of numbers, and I'll try not to overwhelm us too much with numbers, but these are really the key findings from the study. So firstly, 87% of faculty surveyed observed that student mental health has worsened in the pandemic. This was a finding that, really we stopped and thought about, and, in some ways it's not surprising. 43% of faculty say that they perceive student mental health to have significantly worsened throughout the pandemic. And I think this reflects probably at least two things. One, an actual, continuation of that trend I showed in the beginning in terms of rising prevalence rates in student populations. And then secondly, a heightened awareness of faculty and heightened exposure for faculty to really see what students are going through, and also that mental health has really been impacting students' academic performance even more than before. So nextly, about 80% of faculty report having had one-on-one conversations with students regarding their mental health. So these are one-on-one phone, video, or email conversations with students in the past 12 months about student mental health. The likelihood of having had these conversations does vary a little bit by academic discipline as well as by gender identity. So faculty members in the social sciences, humanities, and arts reported more conversations with students about mental health, while faculty members in business, law, science, and math reported lower levels of conversations with students about mental health. And female and trans and non-binary faculty members reported more conversations, and male faculty members reported fewer conversations. So this is the slide that, I think really highlights the opportunity that we have moving forward. So 3/4 of faculty members say that they're likely to reach out if a student is in distress. But only half of faculty say that they have a good idea of how to recognize this. So it seems to me, and it seems, I think many of the folks that I've been talking to initially about these results, that we really do have an opportunity here to build the skills of faculty and to deliver more resources and support, because faculty say that they are likely to reach out. We also asked faculty about the reasons why they wouldn't reach out, some of the barriers that they perceive for trying to support students. And as you can see here, 50% of faculty say that there's no reason that they wouldn't reach out to a student if they thought a student was in distress. So no reason that they would always do so. But the most common reasons that folks did report in terms of why they wouldn't talk to a student in distress were, I wouldn't want to make the student feel uncomfortable. Someone else is better suited to do this. I worry I could make things worse. And I'm unsure of what to do or say to a student. And so normalizing that to faculty, it is hard to know what to say, and we can do a better job of kind of increasing the comfort of faculty in having these conversations. I also want to note here that I ordered the response options by how commonly they were reported by faculty. And you can see that the least commonly selected option in this select all that apply survey item was, it's not my responsibility. So only 3% of faculty indicated that they don't think it's their responsibility to reach out to a student if they think that student is in distress. We also included items around faculty members' knowledge and attitudes pertaining to substance abuse among students. So I'm just going to share a few findings related to that as well. So what we find is that faculty are even less confident recognizing signs of and having conversations with students about substance misuse. 29% agree that they have a good idea of how to recognize that a student is experiencing signs of a substance use disorder versus 51% around student mental health. And 38% of faculty agree that they feel comfortable having conversations about substance use with students versus 64% for mental health. We also looked at faculty's knowledge of mental health resources. And so the item was, I know what mental health resources, if any, are available for students at my institution. And this is showing the proportion of faculty who agreed or strongly agreed with that item by numbers of years of faculty experience. And you can see that faculty members with less than 1 year of experience have the lowest levels of knowledge, and faculty with more than 15 years have the highest levels of knowledge. So this might have implications for new faculty orientation, for example. We also wanted to understand whether or not faculty are participating in gatekeeper training programs. So gatekeeper training programs are typically brief programs designed to equip lay people, so non-mental health professionals, of which the vast majority of college and university faculty members are, to equip lay folks with the skills and knowledge to identify individuals in distress and to make referrals. So only 56% of faculty indicated that they even know whether a gatekeeper training program exists on their college campus. And the majority of faculty, 72%, have not participated in any gatekeeper training program. However, those that have found it to be helpful. Here's really the good news that, I think this is where we can really take practical action items based on this. So over 2/3 of faculty agree that they are motivated to strengthen their role in supporting student mental health. Nearly 3/4 of faculty agree that they would welcome additional professional development on the topic of student mental health. And 61% of all faculty surveyed agreed or strongly agreed that it should be mandatory that all faculty receive basic training in how to respond to students experiencing mental or emotional distress. We asked faculty about their preferences for what this training might look like, and faculty indicated that they would prefer trainings that are online, that offer advice for general student support instead of just suicide prevention or crisis training. They want these trainings to be self-paced, and they want them to be brief. In addition to trainings, faculty want a list of mental health resources available at their institutions. They want a checklist of things to consider regarding warning signs of mental or emotional distress among students. They want a small reference guide for how to initiate a conversation with a student. I think it's particularly important that that reference guide be really tailored to faculty and to the role that we play. And they also want a statement on mental health to include in their course syllabi. So I have two more kind of slides with statistics. And they're really important ones. So the next thing I want to talk about is we included a small number of items around faculty members' perceptions of the campus climate. And this is really important when we think about the trust that faculty members have in making referrals on campus. And you can see here, we asked faculty to rate the climate at their institution for students from the following backgrounds: students of color, international students, and sexual and gender minority students. And you can see here that 1/4 of all faculty perceive their campus climate to be hostile or somewhat hostile towards students of color. And that is much higher among Hispanic or Latinx faculty, of which over half perceive the climate to be hostile or somewhat hostile. And over 1/3 of Black or African American faculty perceive the climate to be hostile or somewhat hostile. Also circulated in the follow-up materials from today's webinar will be a task force report written by the Steve Fund, which really outlines strategic directions that campuses can take to prioritize the mental health and well-being of students of color. And I'm thrilled that some of our colleagues from the Steve Fund are here today. And lastly, it's really important for us to think about the fact that faculty are themselves, really struggling. We included the patient health questionnaire 2, just a brief 2-item screen in the faculty survey. over half of faculty indicated at least one symptom of depression on the PHQ-2. And different cutoff scores have been used when talking about the results of the PHQ-2. If we use a cutoff of greater than or equal to 2, and the scores range from 0 to 6, and higher scores are indications of higher levels of symptoms. So if we use a score of greater than or equal to 2, 33% of faculty members screen positive for depression. If we use that higher cutoff of greater than or equal to 3, 10% of faculty screen positive for major depression. Importantly, 20% of Hispanic and Latinx faculty meet that criteria with a cutoff of greater than or equal to 3. Over 4 out of 5 faculty members agree or strongly agree that supporting students' mental health has taken a toll on their own mental health throughout the pandemic. And this toll was higher for female, trans and non-binary faculty, as well as Hispanic and Latinx faculty. Nearly 50%, so I'm really struck by that number, nearly 50% of faculty think that their institution should invest more in supporting faculty mental health and well-being. And only 30% agree or strongly agree that they know what mental health resources are actually available for them, for faculty at their institutions. So I'm going to wrap up by just talking about our next steps in this work. So we know that faculty play an enormous role in shaping student success. Having a personal connection with a faculty member is associated with higher student satisfaction and sense of belonging. Having a supportive professor or advisor is associated with higher retention. And now more than ever, faculty members are really on the front lines in terms of being able to identify students in distress and refer them to help. The results of these data, which again are hot off the press, indicate that the majority of faculty have observed student mental health worsening in the pandemic, that the majority, again, 80% of faculty have had conversations with students about their mental health in the past year. But faculty have relatively low confidence to serve as gatekeepers, and few have been trained. The good news is many faculty are welcoming of new resources, and we have some indications of what that might look like. Building off of all of this research and just knowing how important this topic is, our Healthy Minds team is thrilled that we're going to be launching a national version of this survey in fall of 2021. And we're actually going to be expanding the survey to include both faculty and staff so that campuses can survey students through our Healthy Minds study and also survey all faculty and staff to get a really comprehensive picture of mental health across campus. So I'm just thrilled to have been a part of this project. And I think that the conversation that follows, I'm really hoping that it can inform our research in at least 2 ways moving forward. One, the questions and comments and discussion might motivate us to analyze our pilot data from spring 2021 in new ways. We've really just begun that analysis. And secondly, that the discussion might motivate us to include new measures in the survey that we're going to launch in fall of 2021. So I'm really looking forward to the rest of today's program. And with that, I will turn it over to Kirk Carapezza at GBH.
Sarah, thank you so much. That was great. Thanks again for your research and for that presentation. As you know, this work is so important right now, Sarah. And we have a great panel here to talk specifically about your findings and generally about faculty's role in supporting students' mental health. Zoe Raguzios is president of the Mary Christie Foundation, and she's also executive director of counseling and wellness services at New York University, where she oversees the mental health services for more than 40,000 students there at NYU. Hi, Zoe.
Hi.
Lisa Schnell has taught English at the University of Vermont in Burlington for the past 3 decades. She's also served as dean and director of undergraduate studies in UVM's English department. She's teaching courses this semester on Shakespeare and Milton, including a course dedicated completely to the epic poem Paradise Lost, which I had the privilege of auditing just yesterday. And I must say it's very timely, Lisa. Thank you for being here.
Thanks for inviting me.
We also have Aswani Valetti. He's provost and vice president for academic affairs at Elon University in North Carolina. Before that, he served as dean of UNC Wilmington, where he helped to launch several new programs, including a doctoral program in psychology. Aswani, thanks for being here. think you might be muted.
Thank you, Kurt. Nice to be here.
Great. This is also a sound check as well as the introductions. And Michael Gerard Mason, he joins us from the University of Virginia, where he is a dean in the African American Affairs Department. Michael is also a psychotherapist who's developed peer training for students and professors on the Charlottesville campus. Michael's also an expert with the Steve Fund, which focuses on the mental health of minority students. Michael, thanks for joining us.
Yeah, thanks for having me.
So let's jump right in here. There's a lot to consider, a lot of interesting new findings from Sarah's research. Lisa, do you see your experience as an English professor on campus in these findings?
Yeah, I do. Absolutely. And, I was aware of the trend that Sarah talked about before the pandemic. I've been really aware of it since the pandemic. And yeah, students are self-disclosing. I'm aware just by observing, but yeah,
what does it look like? I know you're teaching hybrid, right? Some of your students are in person, some are online. I know, yesterday, some of your students who had actually contracted COVID were quarantining at home and waiting to come back to campus. When you say that, you see this in your experience, what does that look like day to day?
Well, sometimes day to day, it's just who's showing up and who's not showing up. So for me, as a faculty member, sort of the lowest hanging fruit for me in terms of kind of intervention is if a student isn't coming to class, there's usually a reason why they're not coming to class. And sometimes, sometimes that reason is not related to their health or their mental health. But honestly, usually it is. And so that's the first thing. I just look to see if they're coming to class. I reach out when they're not. They're usually really grateful for me to reach out. I don't ask them why they haven't come to class. I just tell them that I'm concerned and that we miss them. And if there's anything I can do to, if there's anything I can do to help. But yeah, attendance actually is the main thing. And then just affect. It can be hard over Teams in a video call. I do teach in person as well. And so I look for affect and I see it. Even with a mask on sometimes, you can see when somebody is really unhappy.
There's a narrative though that, that faculty don't want to be involved in students' mental health, right? That this is beyond their responsibility, that they're focused on teaching and research. On campus there in Burlington, do you get a sense that some faculty might think we're asking too much of them? Because one of the findings in the study that I found interesting was that 75% of faculty said they'd welcome additional training. So that indicates that they want to be more involved. What are you hearing from your colleagues?
Well, not as much as I used to because we don't see each other so much anymore. But here's the thing. I mean, I think that there was a question that came up while Sarah was doing her talk about what's meant by student mental health, and I think, and that's a really good question. And I think that I certainly don't feel well equipped to deal with a really urgent mental health crisis that is beyond loneliness, isolation, alienation, just the feelings that accompany the pandemic, which definitely affecting people's mental health. And I think that sometimes faculty are worried about that. Like, I'm not trained to deal with somebody who's having a psychotic break. That's not my responsibility, although I was really, really happy to see that was just a 3% response was the responsibility. That's not mostly what we see. I mean, I think mostly what we see are things that are I actually refer to them as the human condition. It's not that people aren't suffering. It's not that they don't need help, but that establishing connection with other people is kind of what they need. And it's been really, really hard to do that in the pandemic. I think because we understand that as faculty, we're suffering in the same way that the students are, maybe less actually. I think that demographic is really suffering. I don't know whether that number would have been as high before the pandemic of people saying they're willing to that they do want to reach out, that they do care. I think it would have been high. I don't think it would have necessarily been that high. I think we're all human together in the pandemic. We all know what we're going through. And it just makes us, I think, much more willing to be a little bit more vulnerable with our students and to reach out in the way that I think is really meaningful to them.
And as a humanities professor and as an English professor teaching, Paradise Lost, which is all about the human condition, about human suffering, in many ways, this is kind of baked into what you do. I want to bring Zoe into the conversation here. Zoe, how do you, the data suggests that faculty do see students' mental health and well-being as part of their responsibility, and they want additional training. What more can administrators do to support faculty, to support all faculty, especially those that may not be teaching, Paradise Lost?
Definitely. So I think that it's abundantly clear that counseling services are not going to do this by themselves, and that it really is about university administrators working together as a collective. And so I thank you for starting with that. It really has to start at the top, I think, with the president's offices and the provost offices sending clear and consistent messages that mental health is a genuine priority on their campuses. I think it starts there. After that, I think you should really look at the obvious rewards. The data is telling us that the faculty want to help, but they need more training. So the training exists. Most schools have a training in place to detect and respond to students in distress. The real question is, how can this be disseminated widely? And how can faculty feel that they have the time and the incentive to participate? And then the big question about, do we go so far as to make this training mandatory? I've been involved in mandatory trainings at NYU, not around mental health, but other subjects. And mandatory then really does take on this 4-letter word idea. And so the question is, can we incentivize faculty and make rooms in their schedules and maybe alleviate them of some other responsibilities so that we don't have to make it mandatory? Can we incentivize them to opt in so that we don't really have to, grapple with whether to force people to do a training? That's one question that I have.
And at NYU, it's as you said, it's not mandatory. I remember, I think a couple of years ago, I observed you.
That was
you
fun.
Running one of these training sessions. It was an anthropology department, right? I think they had asked you to come in. So what's your experience with that? It's a case by case basis where you kind of respond to faculty demanding it.
That's right. So, at NYU, it's voluntary. Over the years, I've had a lot more people opt in. It either is because a particular faculty member has interacted with a student and had questions and then invited me to their departmental meetings, or because the chair of the department thought this was important. And so I got invited sort of top down in that way. But it is, and the other ways that I participate is that new faculty get a training where I get a little bit of time to sort of at least introduce the fact that we have mental health services on campus. That's a certain set of faculty, but sort of the bigger your institution, the more likelihood that some people won't opt in.
And Zoe, we should say you advised Sarah in your role as president of the foundation. Why do you think it was so important that the survey included that question about campus climate?
I think we can't separate the idea of one's environment from the way they feel from the psychological perspective. If the pandemic has highlighted anything for us, it's that our environment affects our mental health. The fact that large numbers of faculty don't see their campus environments as welcoming to students of color is a major concern. As Sarah said, if they don't trust the services within their institutions, they won't refer to them. But as far as I'm concerned, the subjects of belonging and inclusion and diversity and mental health are all one, and that the diversity offices at our institutions have to be hand in hand with our student health centers and campus life units, because we work in the same world. to make sure that students prioritize their health and safety. So it was imperative to ask the question because, again, you can't separate one's psychological stability with what's going on in the world around them and how they feel about that.
Swani, I want to turn to you there at Elon University in North Carolina. When you see that number, 87%, nearly 9 in 10 faculty say that they believe their students' mental health is declining or has worsened over the past year. Are you surprised by that finding?
That's a great question. The answer is no, and for this reason. The point is, it's not just a student issue, right? I mean, the last year plus, what we went through as a nation, as a world, these are unprecedented times. It's not just that the students are facing these kind of challenges and difficult time, but when you think about faculty, staff, who also are juggling perhaps giving care to an elderly person at home or taking care of their children, daycare, schools, remote learning, etc. Right? So when you think about the mental stress and trying to balance the professional life, the personal life, it's been challenging for everybody. So I would frame it as a community level stress and not just student level stress. Recognizing what I, as an administrator, go through, looking at what my colleagues, faculty, staff go through. And I actually taught a class last fall just to see what the faculty are seeing and just to experience what the students are experiencing in a classroom. Right?
Well, what course was it, and what did you learn?
Oh, it's an Elon 101 class. I had the privilege of teaching with an English faculty member, co-teaching an English faculty member. It's about introducing Elon to freshmen and how do they mapping out their 4-year career path, including advising and those kind of stuff. A lot of times, of course, the students are concerned. But before I get to that, I also want to address one thing. Oftentimes, when faculty are expressing concern about their ability and capacity to support student mental health and well-being, they probably are also thinking about their skills with addressing mental illness or mental health concerns, right? While it is true that this level of care often requires referrals, and there are certainly software programs that help faculty and staff with skills to ask questions, make referrals, and all those things, more often than not, what we're actually referring to is needing to address with students is the mental wellness or mental well-being, right? And in most cases, what students need is an empathetic, caring individual who can take time to help them problem solve and build strategies and connections. And there certainly are resources to help guide these conversations, but what is really required is a genuine, authentic expression of concern. That is the first thing we need to get started. And second thing is role model it, right? We're all stressed. It's okay to say, I'm just as stressed too. But the key is, while we don't have all the tools and techniques similar to professional counselors or mental health professionals, we can make sure that we connect students with the resources they need, right? I know Lisa and Sarah, et cetera, they talked about this before. It's not a student issue, it's a community issue. And make sure that resources are explicit, right? And I think one of the slides referred to the longer you stay at an institution, the more aware you are about the resource at an institution. Not surprising. But so it underscores the point that while there are resources on campus, and while the faculty members are willing and able to help students, they may not be aware of those resources, right? So as an administrator, it is a take-home message for me to make sure that every faculty, every staff are at least aware of the resources that are present on campus so that they can help the student, right? It could be including on syllabus, or it could be making sure they're visible, etc. And so I think there are a lot of these kind of things that we can look at. But really, the key is to make sure we are not in isolation. We need to work with student life, et cetera, in concert to solve some of these things.
Yeah, there was a finding in Sarah's research that found 20% of faculty reported that supporting their students' mental health was affecting their own mental health. And you alluded to that. These professors have their own lives going on, right? They might be caring for kids or for aging adults. I remember, my own college experience. at that time, the phrase mental health just wasn't part of the lexicon. It was like, if you were anxious or tired, it was, you just say, oh, I'm stressed out. And I remember I had a professor, around exam time would say, study up to a certain point, and if you're feeling stressed, crack open a beer and just relax, and just kind of don't cram all night. As an administrator, supporting these faculty, what more can you do to support their well-being?
Yeah, actually, we've clearly we could see this coming, right? This is the pandemic that's going on worldwide. Things are not necessarily going to get better when you get an executive order from the governor that now we are restricting fill in the blank XYZ, including campus activities, etc. Fortunately for us, at least at my current institution, we've already instituted a university-wide committee on mental health and mental well-being that came out as a strategic priority from the 10-year strategic planning process that Elon went through. So we actually constituted, I should say, a university-wide committee that is representative of faculty, staff, students, focusing on campus-wide mental health and mental well-being. So that kind of gave us a little bit of head start. But then the next one is also looking at the support structures that the students need. For example, we know that we need to bolster the student care and outreach office. We know that there will be a lot more pressure on counselors, et cetera, so we double down and increase the resources in those areas, for example. Acknowledging that there is that issue is the beginning, right? And be intentional about it. It's not simply enough to put it on a constituted committee or put it on your website, but actually put resources behind it. Right? I mean, if it is a priority, it is a priority. And one of the ways to show it is by actually putting resources behind it. And
is that one of the institutional challenges, though? You say it's one thing to just say we got to put resources behind it, but is money an issue here where, the cost of college is probably the top issue for students right now? When you say we got to put resources behind it, that means money, that means maybe higher tuition.
Well, it's not necessarily. It could be all. It could also be reallocation of resources, right? For example, when a lot of the campuses went on hybrid or remote learning, you might have some individuals where the workload is less in some areas and a lot more in other areas. And when possible, you could actually deploy some of these resources into areas that are high need. And we are very proud to say that we haven't laid anybody off. We haven't engaged in workforce reduction of benefits, etc. We worked really hard to make sure that the individuals helped out in their capacity. For example, some of the athletics folks, anywhere from coaches, assistant coaches, and all those things, they helped out in testing. These are phenomenal mentors, right? Because they already serve as mentors to athletes and stuff. And they already have the skill sets, working with students, etc. Or like deploying some individuals to greater testing. We tested every student every week, at least this spring. So redeployment of resources is one thing. But at the end of the day, sometimes you do have to make some difficult choices as to where you're going to invest resources. If students are front and center and focus of your institution and looking at the resources they need, you probably had to do some of those things.
Michael Gerard Mason, I want to bring you into the conversation. And just a reminder to everyone tuning in here, if you have a question, you can put it in the Q&A, and we're gonna open it up in a few minutes. Michael, Sarah talked about that experience last semester when she realized that in many cases she was the only person from her university, Boston University, who was seeing certain students every day. And I remember when we reported on this mental health crisis before the pandemic, one of the takeaways was that the faculty play such a key role because they see the students every day, right? The students aren't walking through the mental health services office, or they're not part of your your peer counseling program. How do you well, I guess the first question is, do you think that this pandemic has really highlighted the fact that that faculty are on the front line?
Actually, I think we've highlighted something else. If I start to think about the history of the development of student affairs, well, first of all, let me just introduce this crazy thought that I sort of sit at the intersection of everything at a university. I'm a clinician, associate dean, and a professor. So I sort of am thinking about lots of this. So one of the things that I think this pandemic has highlighted is the interesting dilemma we created when we began to champion student affairs as a separate sort of functioning institution within a university. And I think that was sort of interesting because, in the mid 60s, as that happened, professors started to be liberated of the responsibility to be thinking about the emotional wellness and student development of students and begin to focus more on this currency of A's, B's, C's, D's, and F's, right? I think that's when that started to happen. What happened in the pandemic is by going virtual, we broke all of the in-person structures. So all of those passive contacts that students were having, cafeteria workers, store clerks, peers, church assemblies, study groups, all of those things that were happening that sort of mitigated the impact of the anxiety evoking things that happened in the university were broken. And then what happened is we began to rely almost exclusively on faculty to do all of that in ways that they might have been doing in the 1890s, 1930s, but definitely not since 1960. So to me, I think that's what happened. It started to highlight the necessity of us starting to reconsider colleges and universities as communities, as Swani said. I think we have to start to think about it as a community, or maybe even concentric circles of support, where faculty have a role, student affairs has a role, the hospital has a role. We all have roles that are interconnected. And I think this pandemic actually just highlighted, first of all, that's broken. And I think we have to spend some time sort of thinking about what that means to us. I think the other thing is, in my work at UVA and to the, some degree with the Steve Fund, I do spend quite a bit of time trying to reorient faculty to what the currency actually is, right? I think, if everybody gets A's, the faculty is excited, they feel great about it. But I don't know that they're actually thinking about what A's often represent. And from my perspective, I'm trying to help students think about, and faculty sort of acknowledge that an A usually means there's an abundance of time invested in the course. There's probably a significant degree of mental wellness that's good. There's probably an abundance of social supports available to the student. And one that I am particularly fond of is that the student is probably situated that they're getting sufficient sleep, right? These are things that are necessary. Now, when I see a B as a professor, I start to wonder what is happening in those four categories, right? Those are things I get interested in. And I think the more of us faculty members who can sort of think about that, the more we start to appreciate what that A is actually translating. And it's not just intelligence. And I think that's something that broke also in the university, that we started to assume A means intelligence or A means agency, when actually it's a quite complicated metric that we need to be mindful of. So I think that's also something that happened in this pandemic, that faculty are now realizing that a lot goes into that A, and they have to figure out now how they actually attune to it. Because, to be honest, 16 months ago, as a faculty, I didn't have to worry about it. Well, I is with a capital I, because if somebody was having a psychotic break, people called me at the university to deal with that. But with the big I really didn't have to think about that because I knew where to call. I could call CAPS, or I can call psychological services, and that happened. But that definitely broke. So I do think there is some baseline expectation for faculty to be available and empathic and understanding that emotional wellness connects to performance. I do think, though, that student affairs as a division across the country has become extraordinary in protecting universities from the reality that our students do suffer, and that suffering has implications. Student affairs, when it is working really well, it prevents the university from knowing what is actually happening. It's quite a bubble. And I do think that's happened. So if anything, the pandemic crippled student affairs, which then burdened professors.
Right. And you talked about that baseline. Is the baseline too high at this point? And if so, that baseline expectation on faculty to deal with these issues, how do you suggest we lower it? in our current environment?
Well, I don't know if I would say the baseline. You know what? I'll be kind to my colleagues. The baseline right now is actually very high. I mean, to be frank, most professors are accounting for, the vast majority of contact students have with the university right now. That's real. And that can't be so. And I think that's partly just because we didn't know. First of all, I had never heard of Zoom, right? In March of 2020, I didn't know what Zoom was. Now I live in it,
Right. At GBH, Zoom was just a TV show that we produced 12 months ago.
Well, there you go. But I didn't know. So I definitely didn't know how to translate these really complicated evidence-based interventions that I do in student affairs to Zoom, right? So I do think that part is broken. And I think we're catching up now. Well, just as I thought I was catching up, I realized that people had gotten Zoom fatigued and then everything broke again. But we're trying to figure it out. At least we know we have to be thinking about it. So I think, yes, I do think the bar is high. And I think we have to double down on the effort to let professors know what resources are available, what things are still working well, so that they can begin to refer as they do notice. And I think one of the things that I commented on maybe in another context is, as a professor, one of the things that I feel particularly handicapped with is cameras. Like the viewers here are very lucky in that 100% of us have our cameras on, right? In classes, you probably have 90% who don't have their cameras on. So all of a sudden, as a faculty member, I have lost all of the non-direct ways that I'm sort of seeing how students are doing in my class. And I can see how that actually cripples a whole lot of things, especially when students need the feedback from one another in the class to sort of, settle themselves and knowing that they're doing well, or that they're getting ideas, or that they're understanding each other. All of that's broken in Zoom. And I do think, we'll have to figure out, how to, replicate some of those things. And I think as we do that, that will bring down the bar a little bit on faculty. But right now, I do agree. I do think that the bar is quite high, just because it is what we have. We have faculty who are connected to students who are learning remotely. And now we need those faculty members to make connections to all over the place. And that is quite a burden.
And that pressure that you talked about on the faculty, knowing that, you might be teaching a class and the students are seeing you, and that's their one experience with the university that day. And we've all had professors that, might not have been our favorite, right? But you then come out of that class and you have a different experience on campus that you then associate with the university. If you have, one professor that you don't get along with, or that, you're not jiving with, then that puts a lot of pressure on the professors to put their best face forward all the time at a time when we're all stressed.
Absolutely. Yes, absolutely. And as a random aside, I think I can't imagine. I'm probably at least 80% in every class I've taught virtually. I have always had at least one student who's attending in Zoom who's driving, which is a mind-blowing thought. But when you start to think about how these students are trying to access learning in the middle of living in the pandemic, that has implications. And I think we just all have to acknowledge that we are all multitasking, multi-living, whatever phrase you want to use, trying to figure out how to do this. And hopefully, going back in person, whatever that means in the fall, will alleviate some of this.
Michael, what do you make of the finding that a large number of faculty report hostility towards Black students on their campus? As a clinician and as dean of an African American Studies department, what do you make of that specific finding?
Yeah, that's a big question. I guess the first thing, as a statistician, one of the things I want to help us name a little bit which is interesting for those of you who get the reports and you'll sort of go in and you'll look at these numbers. That the complicated thing about percentages is they mean different things, right? In this sample, I think 2.5% or so of the sample is African American, and about 2.5%, I think, of it is Hispanic. So when we start to look at these numbers, we're starting to look at like 24 Hispanic professors and about 17 Black professors, something like that, if I got the math right. So when we say large numbers, I think that's something that we have to sort of quantify so that we know what we're dealing with. One of the things that as I'm sort of talking about that, one of the things I want to highlight is for anybody who's thinking about trying to think about faculty and leveraging faculty to be helpful to students, you have to, one, acknowledge that we're talking about Black and Hispanic faculty represent 2 to 4% of the population of professors across the country. So that's something that we have to name and figure out a way to sort of address that however we can, that we're talking about a very small number of people. Now, that said, I do think one of the things that I've noticed since 2016, probably at the pinnacle, for instance, of the Black Lives Matter movement, one of the things that I noticed is that there has become quite the intolerance for the glacial pace of change in culture in universities. And I think that's something that universities are going to have to contend with. So when I start to look at this number, these percentages of faculty who are having concerns, I do think that's part of it, where we're saying a student, posted a statement that said, QAnon forever, in a location where there is primarily Black residents, right? Or something like that. Or even, not to necessarily politicize this, but, Trump 20 forever. I've seen that, at our university. And we don't quite know what to do with those things, right? Because, at the same time that we are very invested, and I am very invested in this conversation around freedom of speech, at the same time, now we are in a different context where students are trying to negotiate how do they feel safe, or how do they feel protected, or how do they feel like they're in an environment where they can learn the best. And I don't know that we've had time to sort of really dive in and figure out what to do about these things. And I think faculty and students alike are growing impatient with the time that it takes to grapple or work through these very complex ethical, moral, and legal dilemmas that face us and have faced us for the centuries that we've had, universities. So I think that's a part of it. I think the other is students and faculty alike are looking towards the university to be very transparent in the positions they take in these social crises, right? And I think that also becomes a dilemma, because often the university, the board of visitors, and the president are not necessarily in the best position to just come out each time something happens, right? And say, we stand against X, or we stand with this. And I think students find that, lacking, where they are looking for immediate advocacy, immediate support, immediate championing of their issues. And I think that's complicated. And I think what's also complicated is the polarization of response, in the sense that if it is not present immediately, students and faculty and communities assume the alternate possibility. If you don't stand with me, then you are passively supporting X, which is probably not a
Right.
realistic paradigm. But I think that's probably contributing to this. But the reality is, as a Black, I'll speak specifically now as a Black professor and student affairs administrator, I do struggle to see issues that are not new to us. The things that we're talking about now, we were talking about in 2000. We were talking about in 1980. We were talking about in 1960. We've been talking about over the duration of mass enrollment of Blacks and people of color in predominantly white institutions. We've been talking about this for decades. So I can understand this thought that if all of these brilliant minds, generations of brilliant academicians, historians, teachers, professors, administrators, generations of us have not been able to fix these age-old problems. At some point, people might assume that now it's starting to be willful inability to fix problems, right? That makes sense to me, that we haven't fixed it, not because we don't have the agency and the mind to, but we don't have the will to. And I think that's probably a shared sentiment, probably across the country.
Michael, that was great. Thank you. I want to turn to some questions from the audience. We have a number of questions here. Amelia Area asked, this might be a question for Sarah, if you want to jump back on. Amelia asked, what about differences by institutional type? Are community college faculty members less or more likely to feel it's their responsibility than college professors at four-year institutions?
Yeah. Hi, Amelia. I'm so glad that you're here. So we only had one community college actually in this sample of institutions. So I think that's a really important question for moving forward with this research, to be able to look across institutional types. But the pilot study data don't permit that.
Thank you. Another question here from Ann Converse Wilcor. Hopefully I'm pronouncing these names correctly. Can someone speak about the juxtaposition about penalties for missed classes and mental health? Maybe that's a good question for Lisa or Michael, who are actively teaching.
Yeah, I mean, I kind of gave that penalty thing up a long time ago. I mean, I tell students that participation in class is mandatory because it's just part of the class. We talk a lot in my classes and we learn a lot in that space, and I expect them to be there every day. But when they miss class, I actually do reach out to them and just tell them that I noticed that they weren't there. And I think these days, especially, like, having a penalty for missing class is ethically unconscionable, honestly. I mean, I think that they're like, students want more than anything else to be connecting in class. I mean, that's like you said, everything else is gone, like this place they can be. And so especially in the pandemic, like that it's not a policy that I have anymore, that I would dock any points for people missing class. I try to do everything I can to make sure that they can get there. So that's why I allow students to come in on Teams if they have to be home. I really don't want them to come in from the car. But and if so, I don't want their camera on, and I just want them to listen. And that has happened a couple times, actually, when I've forbade them from turning their cameras on in the car. But I think absence is it's a symptom of something else, and if they're not coming to class for reasons of just blowing it off, actually the penalty is going to come in their grade eventually. I mean, they're just not going to be able to do good work in the class. So I don't see any reason to penalize them for not coming to class. I see plenty of reason to reach out if they're not coming to class. And that's just been a policy of mine for a really long time. I think that's one of the best ways we can do intervention, honestly, is just by taking attendance and then reaching out when they're missing class, especially if there's a pattern or, yeah.
Michael, what about this question about participation? Because you mentioned even the students who are showing up aren't turning the cameras on, so you could argue that they're not fully present, right? Or are paying attention. You know, we're all distracted with everything going on. How do you handle this issue of attendance and participation?
Yeah, I think the shorter response to me is, I remember, so last spring when we were teaching, we found out all heck was breaking loose March 8th. And by March 17th or so, we had all went completely virtual, which is mind blowing. And one of the things that I quickly realized as I was sort of discovering that students didn't have same access to internet, students didn't have same access to structured lives, and all of the things that we've learned now through all of this telling of the experiences during the pandemic, I started to question whether or not predominant pedagogy across higher education was actually biased against people who didn't have privilege. I started thinking heavily about that. And that includes attendance, right? My syllabus is probably not really designed to be inclusive. It's not really thinking about access to it wasn't. So now I've had to sort of question all of these things, exactly what the person is asking about. I think very differently about attendance. I think very differently about my assessments, where you have the classics, research projects, papers, tests, deadlines, all of those sort of things that are very familiar probably don't make a lot of sense, right? Just going forward, they actually don't make a lot of sense. So now I've had to deconstruct my classes almost completely and rebuild them in ways that make sense for people just going forward, where I'm actually not assuming, for instance, that the person who was in every class is the person who best performed in the class. I can't make those assumptions anymore. Or the person who talked the most. We already knew this, right? The people who talk the most aren't doing the best. We know that. But in this case, I actually have completely shifted it. Now, as I'm sort of talking about this, it makes me go back to another question. I'm sorry, people who got questions. It makes me go back to the thought about the faculty bar. One of the reasons why I think faculty are so overwhelmed is not just because of the mental health increase. It's because I think most of us who are committed to our classes and teaching have also had to redouble our efforts to make sure that the classes work. So we're also doing way more to try to make sure the students learn now. And as I was sort of saying that, I realized, to go back in and rebuild a class during the semester that is being offered is ungodly. I mean, it's just terrible to have to do that at the same time that you're doing everything else. So I do think that's a part of it, but I do think we have to completely reconfigure and challenge these basic assumptions that we've had in place for decades about what good teaching looks like and assess it very differently.
Right. And you talk about that baseline, baseline expectations for dealing with or supporting students' mental health, but then also the baseline of, what you're bringing to your teaching. I know Lisa, we were talking earlier about kind of the low-hanging fruit, right? Just knowing the students' names. That should be, professors should know who their students are, right? Yeah. Creating a welcoming environment, which can be difficult this way, on Zoom when we're all talking remotely. I noticed at the end of your class, you handed out cookies at the end of class. A bag of cookies. Is that part of the welcoming environment that you're trying to create?
Yeah, I mean, I told them it's just the toughest semester ever. The least I could do is bake cookies and bring them to class. So that's what I do. And
Michael, talk about raising the bar.
No, I know. My colleagues are going to hate me that I even say that. I don't want it to be a set of expectations. Suddenly you all have to bake for your classes.
Right.
But I also greet them when they come in, even on the screen. I mean, when I was teaching online, when we went entirely online, the rule was kind of, unless you really can't, please put your camera on so that I know you're there. And I say hi. They show up. They pop up on the screen. I say hi. The great thing about the screen is I have if it's a big class, I have no excuse for not knowing their name because their name is right on the screen. So, whether they're sort of realizing that the reason I know all their names is because it's right there on the screen or not, they're really happy to be greeted by name. And in that way, I mean, Teams has been kind of there's gifts, they're little Easter eggs that are hidden in the online environment, and those are some of them. And but yeah, anything you can do to make sure that they're seen, that they know that you see them, that you know who they are, that just acknowledgement. I mean, that's very low-hanging fruit, but it's so powerful, especially now. But all the time. I mean, I think that's one of the things we're going to bring with us. It doesn't stop when the pandemic stops. It's really important that they feel that they have this connection to the community of the classroom. It can be a really powerful community.
I remember I always think of that I think it was a Gallup study that came out a few years ago that found those alumni who say they had a quote unquote valuable college experience shared two things in common. They worked on a project for more than a semester and they formed at least one relationship with a professor, or they felt like at least one professor at their institution cared about them and their future. And I think that applies now more than ever. We have another great question here from Rhonda Friesen. Again, Rhonda, I hope I'm saying your name right. She says, we shouldn't be waiting until students have mental health crises before referral happens. Zoe, this might be a good question for you. How can faculty be a more effective bridge to student services and supports on campus and vice versa?
I think I would start by a lot of what has already been said. If you engage students and open that door for them to feel comfortable coming to you when they have an issue, then they will come to you earlier, and it won't be as a result of you noticing that they have now failed all their tests or they have missed all of the classes. And, even something as simple as a syllabus statement can accomplish that. Especially in big classes where you might not have the opportunity to engage each student individually. By virtue of saying something like that on a syllabus or perhaps on the first day of class, students get the picture that you appreciate them and consider them as whole people, not just what grades they're getting. And I think that really does go a long way. If you make yourself available to a student, they will come to you, they will come to you earlier, and you will be able to point them in the right direction earlier.
Yeah, we have a question here about this kind of follows that thought. If I'm a professor on campus and I want more training, how can I feel supported in bringing up the need for trainings to happen university-wide?
I mean, really, that depends on the institution. I think that if you are genuinely prioritizing the health and safety of your students, you will find ways for people to avail themselves of training, which might mean a little bit of investment in technology. So as the data says, where you can make them accessible to the faculty in the ways they want to access them. And also carving time perhaps in the agenda of a faculty meeting, or, I have faculty departments that every semester they build in a session, maybe a piece of a session for me to come in and speak with them. So if you want to make this a priority, those are the kinds of things that you have to do.
We have another question here from Dory Hutchinson. She says, this idea of community is so critical, and this idea of currency as well. Everything has become so transactional in our campuses instead of relational. How can we promote and implement this idea of institutional courage to actually value students' mental health as a critical to positive outcome for the students? Open that one up to the group.
Kirk, before I answer the question, at least attempt to answer the question, I want to follow up on what Zoe mentioned. Like I said, there are different schools use different software processes, support structures. At Elon, what we do is we use something called Cognito. It's an online simulation software that lets you practice conversations with a virtual student. Now, lets you use it at your own pace. It's open to faculty, staff, and students who are in an ideal position to recognize when somebody is struggling and they can help. I'm sure this is one way of looking at it, but the key is to make sure that faculty and staff know that these resources exist. Right. The counseling services now has a fantastic webpage for us. Now they go through all the resources, including the software package. You can pick a scenario, you can practice, you can simulate, you can, because these are difficult conversations, right? These are not like my biology class, a toxicology class, a biochemistry class that I'm used to teaching. It's a different vocabulary. And trying to put yourself out there, expressing your vulnerability and making sure they understand that you know what they're going through and you're trying to help them. These are difficult conversations. So the key is also to know what resources exist on campus so that they can actually connect the students with that.
I'm just going to give a really quick tip, right, based on what Aswani just said. The simplest way to incorporate a professional when a student is engaging a faculty member without making the student feel like all you're doing is pushing them off, is to say something like, I just want to get somebody, a counselor, to help us with this, right? So you're still partnering with the student. You're still saying you're a team. You're still saying you care, but you're also drawing that line in the sand to say, this is not what I do for a living. I don't have the license, but I want to get somebody to help us with this. You know, I appreciate that you came to me. Let's get somebody to help us with this. It works. And it really, it allows the faculty member to feel helpful, and it also gets the student, if necessary, to a professional who can intervene appropriately.
But what, I guess, just to push back on that though, what if I'm reluctant? What if I'm a professor, you know, who doesn't like talking about, you know, students' feelings, let alone my own feelings? Should professors be instructed to attend to their students' well-being in that way?
Well, so, I mean, in this scenario, the student has come to you already. So you have some choices to make, right? The student has come to you and revealed that they have a mental health issue. So you can simply give them the number of the counseling service, which might work, but for some other students, all the courage that they had was expended coming to you, right? And so we know you're not going to treat them for their, you know, mental health issue, but we want the student to feel like they are being warm transferred at the very least to the right person. And so something as simple as that actually speaks to the discomfort of a faculty member who might not want to get too close to this. They don't want to have to engage, you know, more in the problem, but at least the student feels like they've done the right thing by coming to them, and that they're still a team, but that, you know, the right person isn't here to help us. So let's get that person in the room. That doesn't mean they have to come to each counseling session with the student. It's just in that first interaction so that the student feels validated that coming to the professor was the right thing to do.
Lisa, you
I
told
have
me
in certain cases, like, picked up the phone. Like, this is back in the day when a student could be in my office, picked up the phone and called the counseling and called CAPS for the student because it was that phone call that they could not make. I mean, they were disclosing to me, it was also really clear that they had just been, they did not know how to reach out to CAPS. All I did was dial the phone and give the phone to the student, say to CAPS, I have a student in my office who needs to speak with you, give them the phone, and then walk out of my office while the student spoke to the people at CAPS. I mean, I didn't, like, I'm not counseling. I'm not even asking them to disclose more than they already have, that they're in trouble. I'm just making it available to them in a way that they were terrified to do or did not know how to do. And
that goes such a long way.
Mm-hmm. It's not, I didn't need any expertise to do that. I just needed to know the number of CAPS. And there are faculty who don't know how to get that. I mean, we need to have that information, you know, what are the resources on campus? And I think campuses are a lot better about doing that. I also think we have this tremendous opportunity of this year that we've been through to kind of take advantage of the fact that faculty really do want to know this stuff right now. I mean, like, it has come to roost for us in ways, and because so many of us have suffered in exactly the way we see our students suffering, it's probably not a bad time to kind of take advantage of our own openness to learning how to do some of these things, even if it's just dialing the number.
Lisa, you told me earlier this week that your role as a faculty member is to be deeply engaged with these students in an intellectual community, and in that community, you all care about each other, but you will not, you won't go as far as, to doing the quote unquote counseling that the students might need. Should professors be required to, ask their students how they are? Should in every class, should that be? I know Sarah told me that during the pandemic, she was allotting time at the beginning of the class to just check in with people. Does it become too much if every professor is doing that?
Let me jump in, Kirk. I mean, similar to every institution, we did some surveys of our students, etc. too. Fortunately for us, predominantly we were face-to-face and hybrid. Very small percentage of students are remote. For example, 96% of the students were on campus, 4% remote. 88 to 89% of the sections are face-to-face and hybrid percentage. is remote. So we wanted to know how is it working. And the disclaimer is that now let's put it out there, everybody is stressed, right? It goes for faculty, it goes for staff, it goes for students. But having said that, what the results show is that students who are on campus have an easier time finding a quiet space to engage in instruction, be it classroom, etc., not like going in the car and trying to get to their class, right? And second thing is they have an easier time getting to know their peers and faculty members. And they have the students who are remote have a lower sense of belonging. These are not earth-shattering results, no, somewhat predictable, but I engaged students who work with me from the Student Government Association on Academic Relations Committee as part of what is working from their perspective and what could we do better as an institution. Of course, I hear from faculty, I hear from staff, I hear from the deans, right? I know that I know what they are thinking. So what the students actually said is what came through in Sarah's survey and all the panelist conversations. What the students said is, the first few minutes that the faculty member took time to say, "Hey, Zoe, how was your weekend?" Or, "No, Lisa, how did that thing work out?" So that worked really well. It was very meaningful to them. And the example they used was from a public health faculty member, right? And second thing is, even when classes are remote, some instructors have the breakout rooms, right? In this case, it was Zoom. And so that kind of helped get to know their peers. Right, they get to know their faculty members. And of course, they had a list of things that we could have done better as an institution. They said, well, no fall break. No, students really need the mental health break in those days. Now, we made some modifications for spring break. So I asked them, would you be amenable to coming and talking to the broader accounts that I have about 30, 40 members with faculty, staff, and student affairs, everybody from across the campus. They kind of went through the students' perspective. So that was eye-opening. Actually, we took the feedback from them, made modifications for the spring semester. It actually worked well. These things might seem small, but they have a big impact on students. You don't have to go and help a student with mental illness or counseling services. There are people who are far better equipped than I am in helping those students. But what I could do is, "Hey, Kirk, are you okay? I mean, no, you seem off today. Is there anything I can do to help?" Right? And so simple things make a big difference. And then connecting them with the resources would really go a long way.
Sarah, there's a question here. We've time for about 2 more questions from the audience. So get your question in quickly and encourage people to vote for it so that I can see it. Sarah, there's a good question here about the data. And there's several questions about the quote unquote adjunctification of higher education. Did the data indicate that adjunct instructors have a different view on these measures than tenure track faculty? And are you planning to do a deeper dive on this issue by the type of faculty?
Yes, that is an awesome question. I think really important. And that is, I think, kind of the next direction, the next level of analysis that we're planning to do is looking at adjunct faculty in particular. We know that, many of those faculty members don't have health insurance through their institutions, that they're, carrying a lot of the weight of teaching and supporting students. So I think that's a really important direction and one that is definitely on our radar.
Great. Yeah, I think when we reported on this study yesterday, one of the first reactions that I saw was from faculty saying that, that first we need to support the faculty so that they can support the students. Right. Okay, we've one more question here. 1 second. I'm scrolling through. Sorry about that. Here it is. I flagged it. Okay. We hear that our students are very discouraged when a faculty member refers them to a campus service. They feel that the faculty members are handing them off and don't want to be bothered. How can we as faculty members make referrals more effectively? Lisa, you kind of touched on this about that idea of making the call with the student there. Does anyone else have anything to add about how do you make a referral without making it seem like you're just kind of brushing the student off?
I'll just say one thing, which is, I shared a little bit of data in the beginning around how student mental health affects their academic performance. And so really connecting those dots for students, reminding them that their ability to engage in their coursework, their ability to, follow the things that they're academically curious in, and to, succeed in college is, requires that they be mentally well, and that's a goal that I share for them as well. So trying to connect that. And I found it to be really valuable every time I've gotten any motivational interviewing training, which tends kind of the goal of that is to connect individuals' goals and values with an action. And so to be able to connect the goal that so many students have of learning in college and doing well in their coursework with their mental health, I have found that to be a pretty effective kind of entry point into having that conversation.
I think that Sarah sort of nails it that way. I think it's everything is connected, right? And if you make it clear that you're not just making a handoff, but that you do see it as connected to what they came to college, at least one of the main things that they came to college to do, which was to learn. They don't see it as a handoff. I mean, I think it's like we understand that the dots are connected, and we make sure that they know that that's what we're thinking. And then we try to give them some goals for the class. So, turning things in when they're due and showing up and stuff like that as part of it. We kind of do our part of that as well.
And just on the receiving end, I receive all the students that you all refer, and I will tell you simply the fact that you referred them is the most important thing. They care what you think, and they really respect the expertise that you have. They maybe even want to be experts one day in whatever you are teaching them. And so you making that recommendation goes far further than anything a counselor could recommend for them to do. So, I guess the message is don't be afraid, just do it. It's better than not doing it.
And one more question. We're running very close on time, Michael. I want to address this one to you because it's a question from Virginia, and it actually made me think of some of the reporting we've done in Vermont, where at least I know at UVM there's like a whole wellness program, the WE program, right, where there's a whole like dorm dedicated to students' well-being. This kind of gets at the equity and inclusion issue, I think. Here, this person writes, there are no mental health services here in Virginia. No access to mental health counseling on any of our community college campuses. Michael, can you speak to that this idea of equity and inclusion, where you have in some states mental health is kind of, in some ways, it's like built into the culture, right? It's like part of the lifestyle is and at UVM they've built it into the curriculum. Can you talk about that? If I'm at a community college in Virginia and there's no resources, how can faculty do the kind of handoff that we were just talking about?
Right. Wow. I read a whole lot, and I don't know that I realized that there was no resources in this way in community college. That sounds quite tragic, and I'll look that up immediately after this thing here. But the first thing I'll say, and it actually connects to the previous question. One of the things that I do at UVA is I try to encourage people to develop context appropriate love language. Now, and I know that sounds weird, but one of the things that I noticed at UVA, for instance, whenever I do our needs assessment and I'm sort of tracking how students are coping with difficulties, we routinely see that about 70% of first response to distress is coming from peer groups, whether they're inside the university or outside the university. So that's important to me just to be aware of. And actually, only about 11% of first response in crisis is coming from the people who get paid the most money at universities, faculty, staff, and administrators, which is sort of weird to me. So one of the first things that I would say as a community college is not to necessarily be stressed that you don't think you don't have the human resources to be able to address mental health, because the vast majority of that is naturally happening at the peer level. So what I would encourage you to start to do is sort of think about how you communicate, how you can be available to other people. With our students, I start with a very simple question about how do you recognize what parts of a problem you can carry and resolve and what parts of it you can't and need to discharge. And that's good love language. Here's how I can be a good friend to you. I can do these things, but when you start to ask me these, I'm going to have to get help because I can't be a good friend to you and give you bad help, right? So that's the first thing. And I think I would also start to just communicate that up the level of faculty and administrators in community colleges. Here is how I can be a good faculty person to you. And when this exceeds what I'm able to do, we'll figure out how to get you help. But this thought that there are no mental health resources is distressing. And don't sell yourselves too short, because a lot of empathy, a lot of seeing individuals goes a very long way.
That was great. I think that's a good thought to end on. I want to thank everyone. Sarah, thank you for the research. Lisa up at UVM, Zoe at NYU, Aswani at Elon, Michael at UVA. This was great. It was a great conversation. I hope those tuning in from home got as much out of it as I did. This webinar recording will be posted on the Mary Christie Foundation's website, which is marychristiefoundation.org. The foundation will also email it out to everyone who signed up today, so you can revisit this conversation. Thank you again to our panelists, and thank you all for joining us. Take care.
Thanks, everyone.
Bye.